Hello, everybody. Welcome. We are coming to you live on Facebook with a really exciting 45 minutes. We're going to spend some time talking about men's health, an important topic during this month of June, Men's Health Month. So welcome. My name is Dr. Sos Mboijana. I'm a board-certified internal medicine physician with the Mid-Atlantic Permanente Medical Group in Washington, D.C. I practice in D.C. and suburban Maryland. I've been with the medical group since 2009. I am joined today by my incredible colleagues, Dr. Kwame Akoto, practicing in Baltimore, and Dr. Jason Singh, practicing in Northern Virginia with the same medical group. So today, as I mentioned, we are very excited to talk to you about men's health during this month of June, Men's Health Month. We will discuss the importance of preventive screening, share advice on how to improve your physical and mental health. We'll touch on the difference between men and women in general health and chronic disease. And with that, I'd like to introduce my esteemed colleagues. So we'll start off with Dr. Kwame Akoto.
Hi, everyone. My name is Kwame Akoto. I am a board-certified family medicine physician, been with Mid-Atlantic Permanente Group since 2009, and I'm really excited to be here to go through some concrete steps to help maintain and improve the health of men. And with that, I'll pass on to my other colleague, Dr. Jason Singh.
Hi, everyone. Thanks for having me on. I'm Dr. Jason Singh, and I'm a board-certified family medicine physician practicing here in Northern Virginia area with the Mid-Atlantic Permanente Medical Group. In my practice, one area that continues to grab my attention is men's health, so I look forward to discussing this important topic with my colleagues today.
Great. Thank you, Dr. Singh. Thank you, Dr. Akoto. So just a few items, housekeeping-wise. We are coming to you live. This is on Facebook. So for those of you that have joined us today, please leave your comments and questions in the chat, and we'll try to get to those at the end of the session. If you are looking at a recording of the session afterwards, unfortunately, you won't be able to interact with us. But let's launch right into it. And I think it's a good idea to start off the conversation by talking about high-level men's health, the importance of getting checked, some of the top health risks for men here in the United States. So Dr. Singh, why don't you kick us off with this general topic?
Sure. You know, it's interesting. When you stratify the top 10 leading causes of death by sex, men lead in almost every one of those categories, 9 out of 10. And furthermore, these conditions are often manageable and by and large preventable. So why is that? A large part of it is that guys are just reluctant to see us unless something's wrong. And this is really where we ought to borrow a page out of the women's playbook. Only 40% of the men go to the doctor when they fear they have a serious medical condition. So preventive care like routine exams and lab studies are often missed. And symptoms, when they do develop, are often minimized or ignored, which can then lead to a delay in seeking medical attention. I always tell my patients, if there are 3 numbers, you should just commit to your memory. It's your cholesterol, your sugar, and your blood pressure, because these are risk factors to heart disease, which is the leading cause of death in men. Number 2, closely behind, is actually cancer. And that's why regular checkups are so important. And just being aware of the screening timelines to detect things like colorectal cancer and prostate cancer, which affects 1 in 6 men. So I recommend a more proactive approach than a reactive when it comes to your healthcare and maintenance.
Yeah, it's interesting you say that because I can relate. The topic of procrastination, let's put this off. Let's wait till next week. I'm busy this week. Oh, I need to take care of something else. I think all of us do have a tendency to procrastinate, but I think it's much more prevalent in men. And we've got 3 men here, so I'm sure all of us can relate to that. But I think you make a great point, Dr. Singh, and especially when you think about the statistics out there. According to the CDC, 14.9% of men above the age of 18 rank their health as either fair or poor, which is pretty remarkable when you think of us here in the United States, a developed country. So I turn to you, Dr. Akoto. In general, what approaches do you take to get people inspired, engaged, and excited to take care of their health, especially your male patients?
Yeah, so one approach I really like to emphasize during my visits is there's really two aspects to this, right? So there are things that we cannot change and there are things that we can change. The things we can't change, such as aging or our genetics and family history, those things are there and they're going to impact our health going forward. However, lifestyle interventions are things that anyone is capable of doing, and that is part of the things we can change to maintain our health. So things like having a good, varied, regular diet, regular exercise throughout the week, good restorative sleep throughout the week, making sure you avoid really high risk behaviors such as smoking and high alcohol use. These are really important tools that you can use and they're available to anyone, right? So I consider this nature's medicine. And this is the way I like my men to sort of approach their health. Just break it down like that. Look at the things that you can intervene in and move forward from there.
Yeah, control what you can control, intervene where you can. And I think that's really important, especially as we think about genetics and we think about family history. I'm often struck at how little attention is paid to family history. Often when I talk to my patients, so we'll get into what happened to them, in college or when they were younger. But then when we get into family history, some folks are really tuned in, but others aren't, because I think in a way we haven't emphasized that enough. Family history is important, especially as it relates to the leading cause of death, and that is heart disease in the US and around the world, quite frankly. We know what the risk factors are. We're going to dig into those in a little bit. Smoking, obesity, sedentary lifestyle. But another interesting fact, 40.5% of men above the age of 20 are considered obese. So I think we have a prime opportunity here to really get through to our men, our younger men, middle-aged men, older men, and help inspire them to take this seriously. Lifestyle changes as well are really, really key. So Dr. Singh, I'm just wondering, what approach do you take? Looking at heart disease and how we know this is a leading killer of men, how do you get through to your men to talk about this really important topic?
Thanks, Dr. Mboijana. I agree with you. I think risks is really the central to this topic. And one approach I take is something called the atherosclerotic cardiovascular disease formula. In short, it's ASCVD risk. This is a risk score that was developed by the American College of Cardiology. And what it looks at is the chance of you having a heart problem or a cardiovascular event in the next 10 years of your life. It's fairly accurate. And this mathematical formula looks at risks such as your age, your gender, your race, cholesterol numbers, blood pressure, blood sugar, smoking status, and puts it on this number, and it spits out the chance of you having that event. And if it's a high or intermediate risk, then we start to discuss how best to medically optimize those risk factors that both yourself and Dr. Akoto were mentioning. And it's also an opportunity to discuss the benefits versus risks of starting a statin or an aspirin. And then, of course, the overarching lifestyle changes with diet and exercise.
Yeah, I'm really glad that you mentioned the ASCVD score and that calculation because it is powerful. And I have a portion of my patient population that are really interested and inspired by numbers. Some aren't, but some are. But I heard a story the other day about the typical male patient. This is relatively young male in his 40s, maybe early 50s, does all the right things, goes to the gym, has a healthy diet, doesn't consume too much alcohol, drinks plenty of water. Everything is just going really, really well. And then you hear he's had this chest pain, he's had this chest discomfort. It's been nagging him for 1 day, for 2 days, for 3 days, and yet he doesn't do anything about it. And in this one particular instance, thankfully, he made it into a doctor's office, got seen and evaluated. Long story short, he had blockage in his coronary disease, his very large left anterior descending artery, the widowmaker, as some people call it. And the intervention was done just in time to save this gentleman. And I think what I find is that when I see patients in the office and I plug in that ASCVD score and I turn the screen around and say, okay, well, here is the risk that you'll have an event in the next 10 years. That is really, really powerful. So I find that to be extremely helpful in getting people on board. But Dr. Akoto, I know you have a special interest in lifestyle medicine, inspiring people to take full control of their work. How do you pierce through the noise for your patients?
Yeah, so I give them concrete examples. I'll give you tips that I use myself, things that I've found effective from other patients. And I really try to incorporate just one really basic plan that every patient walks out with that's personalized for them. So there are so many tools available now, online apps, there's just so many things that we can use to help to make these robust plans and keep our health maintained, that I really don't think there are any excuses anymore, right? So all the things we used to say, oh, we don't have time to go here or do this or do that, there are ways to work around this. So I want to make sure every patient leaves out with a realistic plan that's personalized for them, as they go forward.
Yeah, I think that's really key. And I think a personalized plan, and a plan that I think that they can look to their doctor to help them put together. And I think a lot of times we as clinicians play a powerful role in helping to inspire patients. And I want to stick with you, Dr. Akoto. So in your personal life, what is your routine? How do you take care of yourself? I know you're in pretty good shape. I see you all the time, and I know that you take good care of yourself. But what are some of the tips and tricks that you can share with the rest of us to stay healthy and to keep looking young as you are?
Gotcha. So, well, we do know that exercise has many proven benefits for us, right? Including helping with our mental health, helping prevent heart attack and stroke, helping control our blood sugars, maintaining our weight, and just so much more. So the general guidelines are we want to try to have at least 150 minutes of moderate activity or 75 minutes of vigorous activity in a week, as well as 2 days of strength or resistance training of most of the major muscle groups. So what I try to tell people to do is first things kind of look through your schedule, look through your lifestyle. How does that look? So for me, I have a busy work week, and often I don't have a lot of time during the week to get things done. So I may say, all right, well, I want to get that 150 minutes in. Why don't I do 75 minutes on Sunday, 75 minutes on Saturday, and that will be my 150 for the week. Or why don't I put things nearby my desk, resistance bands, things like that, so I can start to target some of those major groups as I go along, and I can try to hit the goals that I want to reach. Now, the other thing to remember, though, is even if you don't hit a specific target, every little bit of activity is important, right? So if you're going to the grocery store, park farther away and then walk towards the grocery store instead of trying to scramble and find the closer spot. If you're in a building, take the stairs instead of the elevator if you can. Those slight little things like that, every little bit of activity counts. I have patients who just like to dance, so they'll go on YouTube and find little videos to dance along to. Think out of the box. It doesn't have to be formal exercise. You want to get activity. In terms of moderate versus vigorous, a good rule of thumb, moderate activity is enough where you could speak to someone, but probably would not be able to sing. And vigorous activity, you would still be able to speak, but probably would need to pause to take a breath every few seconds or so. So that just kind of gives you a good rule of thumb about how much activity you're getting. In terms of nutrition, that's another thing that I really like to go over with my patients as well. This, I think, we sort of take a traditionally approach that sort of focuses on weight loss and not necessarily on preventing chronic illness and maintaining health. So what you want to try to do here is make sure that you look at some of the tools that are already available for you. So we see that diets that are high in vegetables and fruits, plant-based proteins, lean meats, and limiting things like processed foods. So things that are in a box, in a bag, in a can, those seem to be most effective in preventing some of these chronic illnesses, which we'll be talking about today, including heart disease. So, good starting point, you could start with the DASH diet, which stands for Dietary Approaches to Stopping Hypertension. That's endorsed by the National Institutes of Health. Or the Mediterranean diet. All of these resources are available and free online, and you can take those tools and try to incorporate them in your lifestyle. So what I'll do is on the weekend, I'll look through and say, all right, these are the things I want to try to get in this week. And I'll actually map out, this is what I'm going to buy. These are the recipes I'm going to make, etc. If I'm going to go out to eat, this is what I want to try to have when I go out to eat. And that helps by having that preparation.
I'm
So
taking
I'll pass
notes.
it on to Dr. Singh for...
I think you both did a great job discussing some of the management around diet and exercise. And I think the take home that I got from both of you is that each person is different, and it's important to talk to your doctors on developing a customized plan. And I think that's fantastic.
Yeah, I think that's important, and it's also that there's a mental health piece of this that factors in, which we'll get into in a little bit. But I think the mental health piece has to do with how you treat yourself. We have a tendency to be really difficult on ourselves. I have two teenage sons, and I can see this, live in the flesh every single day. We are so hard on ourselves. We don't give ourselves a break. We're pretty good at showing empathy to others. But when it comes to self-care and to self-talk, so to speak, we tend to be extremely demanding and extremely difficult on ourselves. So I think one of the things that I do with the patients, my patients, and I talk to them about health in general, is I say, look, you're not going to be perfect every single day. You're gonna fall down, and then what do you do when you fall down? You get up. So each and every morning, if you think about it, you have a brand new 24 hours to take care of yourself, a brand new 24 hours to attend to the small things. And if you do that, and then attend to the small things one at a time, you're going to have a much better chance of taking care of yourself and a much better chance of a good outcome. If you're biting off a whole lot more than you can chew, you're essentially asking for failure. So I think that's another way to look at this. But I think along that theme and along the idea of taking care of yourself and doing what you need to do, let's transition here to a conversation about cancer. Because as Dr. Singh mentioned, cancer is a major problem for men. And a lot of the cancer that we see out there is caused by external factors. It's your smoking, it's the obesity, it's a sedentary lifestyle, it's the diet that you choose. Colorectal cancer and prostate cancer are big. So in terms of cancer, the approach to cancer screening, just more broadly, Dr. Singh, how do you approach that with men, and what do you use to get people to take this seriously?
Yeah, I think it's important to start the conversation early. And so even just preventive lifestyle changes. We talked about diet for coronary artery disease. There's also diet to have good gut health. And there's a high emphasis on a well-balanced diet and an emphasis on a high fiber diet. I always tell my patients, remember the 3 B's: beans, berries, and broccoli. These foods tend to be rich with fiber, and that's good for your gut. And then also reducing concentrated sugars and limiting alcohol consumption to no more than 2 drinks a day. So very important to just start these early. Don't wait till 45 or 50 when the screening, colorectal screening happens. Start early, get those habits in early, so it's easy to maneuver when you get older, when these screenings do come about. Dr. Akoto, I know you see a lot of patients and have these conversations. How do you frame the conversation, or how do you approach it with your patients?
Yeah, so I agree with everything you said. I like to take that approach by starting early. I like to tell people, well, cancer is usually, for some of these major cancers, has screening tools that have been out there for decades that have been clinically validated. So if we can start these processes at the appropriate time, and we have all of the information that we need to make the correct decision together in terms of screening options, that's going to be really important going forward. For instance, colorectal cancer is the 3rd leading cause of death in the United States. And it really shouldn't be, because it's largely preventable. There are numerous screening tools to screen for colorectal cancer. In addition to that, it's typically a very gradually progressing cancer. So if we can screen for it early, we can make early interventions and really try to help save your life. There are both general and personalized recommendations, and you may have heard some recent changes to the recommendations, which I did want to touch on as well. So previously, we would screen all adults at about age 50. There were a little bit of variation based on personal history, so that could include a family history of colorectal cancer in a 1st-degree relative, such as your parents or your sibling. But generally, we did start at age 50 for most groups. And what we did now is lower the age down to age 45. And there were particular reasons why we did that. Even though we were seeing about a 40% drop in the rate of colorectal cancer for the general population over the last 30, 40 years. Over the last 10 years, we've seen a significant rise in a younger cohort. These are people in their 40s, and they're getting more colon and rectal cancer. For colon, it went up from 5 to 11% in people 45 or younger, and 9 to 15% for rectal cancer. So it's really important that we capture that group, and that's why we lower these guidelines. There are two general ways to screen for colorectal cancer. We have stool tests, which are non-invasive, so nothing needs to go into your colon. And then we have the direct visualization test. So I'll talk to you a little bit about some of the non-invasive tests. One common one is the fecal immunochemical test, or FIT test, as we commonly call it. We use this a lot at Kaiser Permanente. And this test, basically, you take a test kit home. It's non-invasive, so you'll just collect a little sample. It's, you send it back to us, we'll test the sample. And if the test is negative, the recommendations are that you screen every 12 months to make sure that you're current. If the test is positive, then we'll move you on to one of the direct visualization tests. So I'll pass it over to Dr. Mboijana about some of the direct visualization tests.
Yeah, this is a really important topic, Dr. Akoto, and I'm really glad that you went into some of the detail regarding the screening options, because just this morning, I saw one of my patients who turned 50 this year, and just this morning he asked me, he said, well, when should I get my colonoscopy? And what's the difference between the FIT test, which is the immunohistochemical test, and the colonoscopy? And he says he hears from his friends that the colonoscopy is a better test to get. And it's the two are equivalent. If you look at all the recommending, all the expert panels out there, all the guidelines out there, a non-invasive test and a colonoscopy, for example, which is invasive, are equivalent in terms of picking up on colon cancer. So all the major societies agree that non-invasive and invasive are somewhat equivalent in terms of helping to diagnose colorectal cancer. The other way that I look at this and trying to frame the conversation for my patients is this. So you've got a huge cohort of people that need to be screened. And now, especially since the age has been reduced to 45. It used to be 45 for certain ethnic minority groups, but now it's 45 for everybody. So all of a sudden the alerts are turned on for everybody. So just imagine, how long would it take you to get every single adult above the age of 45 through a colonoscopy? It would be a huge undertaking, and the lines would be very long. So another way to look at it is take the general cohort, take all the population that is eligible for colon cancer screening, do a mix of non-invasive and invasive testing, and then that will help you cover the population more quickly. And from that population, filter out the higher risk patients and put them through the colonoscopy first. If you take that approach, and that's an approach that we've taken at the Mid-Atlantic Permanente group, we find that we are able to get everybody who has to be screened for colon cancer, screened for colon cancer. And it really does help us reach that mark of getting everybody screened. The colonoscopy, it's a lot of folks are not thrilled about the idea of getting a colonoscopy. I think you hear a lot of myths and a lot of horror stories. It's really not that bad. Most people don't remember the procedure itself. They remember the prep, but not the procedure itself. But I think that those two pathways are equivalent. And the last thing I'd say about the FIT testing here is that it is such a sensitive test that, and you want that for a screening test. You want, meaning that it'll pick up on the most minor bleeding episode in the stool and send that person over for a colonoscopy. So that's really the word on colonoscopy. I know this is a topic that a lot of my patients talk about, and I'm especially with men. This is something that we really need to continue to have the conversation about. And I just pivot over to prostate cancer, since we're on the topic of cancer for just a little bit. Prostate cancer is another one that is key for men's health, especially this month and in general. There's been a lot of changes in prostate cancer, in how we approach prostate cancer. It used to be, early on in my career, every single male above the age of 40 would get a digital rectal examination and get the PSA blood test. The PSA is prostatic specific antigen, is a blood test that looks at prostate activity. But a lot of that has changed over the last few years. And frankly, some of it has become a little more muddy, if you will. And the term here is really shared decision-making when it comes to screening for prostate cancer, taking into account family history, individual symptoms, ethnic background, picking out the people that are higher risk. In general, we start at age 50, but now the recommendation has been to shift that down to age 45, 40 to 45 to start the conversation. But prostate cancer is another one that's important for men's health. And Dr. Singh, I'm not sure if you run into this a lot, but when it comes to prostate cancer screening, I know a lot of my patients are hesitant to come into the doctor's office because they don't want the dreaded exam. That's what every male is afraid of. And so I'm just wondering, how do you approach that with your patients and try to get them to get the screening done and explain to them how we do the screening?
Absolutely, and you're correct. It's a shared decision-making process. So it's not necessarily my decision. It's also their decision, and knowing what the test really means and is looking for. So we all talk about the PSA. So what does the PSA mean, right? It's a highly sensitive marker, which can really be elevated by so many different things. Infection can bring it up. An intense aerobic workout can bring your PSA up. So you can't rely on just the PSA itself, or if the PSA is elevated does not mean prostate cancer. What it means is we need to investigate further. And I always like to trend it over time. If I see an elevated PSA, let's trend multiple values, because most of the times these will either go down or stay stable. As you know, as we get older, as men get older, our prostate enlarges, and physiologically it's normal to make a higher PSA amount as well. And that's why when you get your PSA value, we like to put that in context of your age. And so I think it's very important to have these levels of conversations early so we know how best to interpret the results and what the next steps would be.
Yeah, that's key. And I think another key to that test is when not to get the PSA test. Avoid taking the shotgun approach to testing. I think this is what we learn a lot in medical school and throughout our training. If you look hard enough for anything, you'll find it. That's kind of the old adage, if you will. And the same applies to the PSA test. So if don't come and see me after you've taken a 35-mile bike ride on Saturday and Sunday, and then come in for a prostate test on Monday, because your PSA will be high. But I also like to stress to my patients that at some point, checking the PSA screening for prostate cancer needs to stop. We've heard this many times throughout our training that if a man lives long enough, he will have prostate cancer. And I forget the name of the study where a lot of autopsies were done on young men who died in I think it was World War II, if I'm not mistaken. And very early signs of prostate cancer were picked up in a lot of those prostates that were looked at necropsy. So the conversation is not just when to start, but also when it is reasonable to say, okay, I think it's probably a good idea, and that's around age 70 or so, that prostate cancer screening with a PSA should stop. But the mental health piece of this is important, and I think that's kind of a good segue into our next topic here. But before we leave the prostate, let's touch on just one last component here, and this is sexual health, erectile function health, which is becoming more comfortable to discuss with clinicians, and hasn't been for a long time, but is still important when it comes to men's health. So Dr. Singh, Dr. Akoto, what are your experiences in terms of men's sexual health, erectile dysfunction, and the effects there that people need to be mindful of?
Yeah, it's interesting. One thing that the pandemic sort of brought out was an increase in virtual access. At Kaiser Permanente, we do a lot of video visits with our patients, and men have found that platform to be a lot more convenient than just coming into the office to talk about sensitive issues like erectile dysfunction, low libido. And I get it, because sometimes it's easier to have these kind of discussions behind the camera at the convenience of your home. And so I'm glad we're able to bring awareness to that and talk about that. Also, erectile dysfunction does not necessarily have to be a performance anxiety issue, it can also uncover other health problems such as diabetes and heart disease. So it's important to talk about it to assess for any other underlying issues that may be going on.
Yeah, I agree. So, I really encourage my patients just to be really forthcoming with me when you come in for your appointment. Let's have an earnest discussion about these sort of topics. I think for men, we tend to feel sort of embarrassed about this topic. And I will tell you, I have a lot of patients where, I see both the husband and wife, and, the husband will come in and kind of like, crawl into the corner and kind of whisper in my ear, like, hey, I have this problem and, I don't know what to do. You don't need to do that, right? So we're men, we see this all the time. We're physicians, and we know that these problems, can arise. Its sexual health is vital to our emotional and physical health, right? So it's important that we address it and try to figure out, what exactly is the cause. Again, like Dr. Singh said, there can be other underlying medical issues that we can uncover and treat and improve. Or it may just be you're getting erectile dysfunction for no particular reason. It could be because you're aging, it could be because you've had other medical problems, it could be because you're on certain medications. And that even touches on some of what we just discussed with the prostate screening. When you get that PSA, if it leads to more invasive tests like biopsies or surgeries or other aggressive overtreatment of a mild prostate cancer, that can lead to things like urinary incontinence and erectile dysfunction. So all of this is important to let us know. It's part of your health as well. You should not have to feel embarrassed. If you feel like the conversation is uncomfortable, start it over, come back and discuss it with us, because we really want to make sure that we are addressing all aspects of your health, and sexual health is one of those aspects.
And I'm so glad you brought up the mental health aspect of things. Such an important topic. I think we know for the past year and a half, navigating the pandemic has brought to light prioritizing mental health again. Even before the pandemic, men's suicide rates were 4 times higher than women's. And now there's this exacerbated risk with some of the social and economic hardships that have been brought from the pandemic. And so preventively, my practice has seen a shift in providing anticipatory guidance to make it okay to share those emotional feelings, and to provide appropriate coping mechanisms. And I think this starts early. This should start as early as our young adolescents. As you mentioned, guys have to learn that it's not unmanly to talk about their mental health. Because if they don't talk about it, what happens? It's internalized, and then your body talks about it in the form of high blood pressure, poor sleep, headaches, muscle soreness, fatigue. And then these can turn into potential behaviors that may exacerbate the problem, such as physical inactivity, poor dieting, or even increased substance abuse. You're smoking a little bit more, you're drinking a little bit more, and then you get caught in this funk and lose sight of the underlying cause, which may be mental health through all this. So I agree with you guys. I think we really ought to encourage that seeking help when needed is a sign of strength and really ought to be encouraged. One of the things our medical group does is we send out a short questionnaire called the PHQ-2. It's a depression screening questionnaire routinely sent to all of our patients. And we're assessing their risk for depression, but any other mental health conditions that may come about. And those patients that screen positive are automatically outreached so we can mobilize resources quickly and often virtually at their convenience. So if you're feeling down or hopeless, appetite's low, sleep disturbances, guilt, the way you're feeling, or having thoughts of harming yourself, reach out to us. We are here to help you, and we have the resources to help you as well.
Yeah, I'm really glad that you mentioned that, Dr. Singh. That's absolutely key, absolutely key. And when you think about the pandemic and the difficult, 14 months or longer that all of us have been through, we do know that mental health has been a huge component of this. And frankly, just like say back in 9/11, I think the repercussions of this pandemic, as far as mental health is concerned, are going to be felt for years to come.